to you. It's obviously no surprise to know we inherit so many things from our parents. Some good and straightforward, like the colour of our eyes, and other less fortunate, like a tendency to certain illnesses. It was something of a surprise, I must say, to me to know that we can inherit a tendency to pancreatitis that affects certain families. So that particular topic is going to be a fascinating one to hear about tonight, and no one better, I think, to tell us about it than Lindsay, who works as a genetic counsellor, you can see, at the Institute for Human Genetics at the Centre for Life in Newcastle, which is itself pretty sort of cutting edge, isn't it? Not say world class. So we look forward very much to hearing about that, and you'll be telling us, I expect, a little bit about what actually genetic counsellor involves.
Yeah,
that will be of great interest.
Yeah.
So thank you very much.
Hello, my name is Lindsay and I work at the Northern Regional Genetics Service based down at the Institute for Human Genetics. It's actually a department of the RBI, but we use the Centre for Life as our base at the moment. And I've been invited here to talk to you about hereditary pancreatitis, so the genetic background to pancreatitis. So I wanted to start off by just doing some general background to pancreatitis, talking about what hereditary pancreatitis is, some of the genetics behind hereditary pancreatitis, and then moving on to talk about genetic testing for hereditary pancreatitis. And then towards the end I'll move on to talk about the genetics clinic and what my role is and my colleague's role is within this scenario. So starting back at basics, what's the pancreas? I'm sure it's kind of teaching Granny to some case, but the pancreas is a gland situated behind the stomach, and it's between the spleen and the duodenum. And that's a definition you get if you look it up in a medical dictionary. So what does it do? It makes bicarbonate and neutralises gastric acid. It also makes enzymes which help with digestion, and it also makes insulin. And if you look in the same medical dictionary, a definition of pancreatitis is an inflammation of the pancreas. So there's different types of pancreatitis. So starting off with acute pancreatitis, it's an acute condition and it's potentially life-threatening. It results in severe abdominal pain, and this is usually caused by gallstones, by alcohol, or can be spontaneous or what we call idiopathic. Chronic pancreatitis, it's a chronic condition, and it can result in an irreversible scarring of the pancreas. It can lead to a permanent loss of function within the pancreas and often leads to an unrelenting abdominal pain. So where does hereditary pancreatitis fit into all this? Well, this is an unusual form of acute and chronic pancreatitis that actually runs in families. It results in recurrent episodes of acute pancreatitis, and in about half of all these cases that progresses on to chronic pancreatitis. And it's thought that hereditary pancreatitis is actually responsible for about 2 to 3% of all cases of chronic pancreatitis. People with hereditary pancreatitis usually have their first attack within the first 2 decades of life, but it can actually begin at any age. The condition carries a higher risk of pancreatic cancer, and at present there's no cure for hereditary pancreatitis, it's just a case of treating the symptoms as they occur. So what causes hereditary pancreatitis? Well, it's a genetic disorder, and it's caused by a change to a specific gene. So what are genes? I wasn't sure how you were with your genetics. So genes are the instructions or the recipes which determine all our characteristics. The packages of information which determine everything about us. So our hair colour, our eye colour, how tall we are. And all our genes are arranged on chromosomes. And chromosomes are just the way of packaging all the genes together in a cell. And we actually have 2 copies of every gene within it that we possess in our body. And we've got literally hundreds of thousands of genes. So in hereditary pancreatitis, the gene that's involved is one which produces one of the enzymes we mentioned earlier, and it's an enzyme called cationic trypsinogen. It's a long name, but basically it's an enzyme that breaks down the proteins in the food we eat. And I think if you go on the internet and look up information on this, quite often it's referred to as PRSS1, That's the kind of scientific name that it's given, and that's quite often how the internet refers to it. But basically all you need to know is that it's a gene which codes for an enzyme within the body. And hereditary pancreatitis occurs when there's a change or a spelling mistake in this gene. And this spelling mistake means that the function, so the gene no longer functions properly, and this spelling mistake is what we call a mutation. So people who have hereditary pancreatitis have what we call a gene mutation. So gene mutations are basically like spelling mistakes. And if we go back to the scenario I said earlier about genes being like recipes for things within the body, and you take this recipe here for ginger pudding, you can imagine in the first instance you've got your 4 ounces of flour, your 4 ounces of sugar, 2 eggs and 1 teaspoon of ginger. If you can imagine having just one spelling mistake in that recipe so that ginger becomes finger, you can see that the end product will be very different. And that's the case when you have a gene fault within the body. So the things that the genes are coding for no longer come out as they should because of that spelling mistake. Another way it can affect the gene mutation to take effect is by altering the reading frame. So if you think that the genes give a list of instructions to the body, so in this case the recipe, mix together the flour and sugar, beating the 2 eggs, etc. If you take just one letter out of that, so it's kind of deleted, you can see it no longer, towards the end of that, you've taken out one letter and shifted everything up, the reading frame of that's altered, and it no longer makes any sense at all. So if that was a code that a gene, produced by a gene within the body, whatever it was supposed to be producing at the end wouldn't come out as it was supposed to. And that's basically the situation when you have a gene fault, and that's certainly the situation in people that have a gene fault for hereditary pancreatitis. So there's 2 common faults, gene faults or mutations, that cause hereditary pancreatitis. And again, if you look things up on the internet, these are given kind of scientific names. They're just given code names R122H and N29I. And that just refers to positions on the gene that the mistakes occur. There's also thought to be a lot more mutations that are less common. And there's also thought to be other genes involved in hereditary pancreatitis that we haven't found yet. So there's still a lot of work to do in kind of trying to find out more about hereditary pancreatitis. So how is it inherited? Well, it's inherited by something called dominant inheritance. I mentioned earlier that all our genes that we have in the body occur in pairs, and we inherit one of each set of these from each of our parents. And someone has hereditary pancreatitis if they have only one of these genes affected by a gene fault. So they only need to have one gene knocked out by a gene fault for them to develop this condition. The condition, if it's a dominant condition, it can affect both males and females equally. And within a family, there are people affected in each generation. So if you look at a family tree, you've got people affected down the generations, and you can see the gene tracking through the family. And obviously, when you've got a genetic condition within the family, it obviously has implications when people come to have children. And this picture just illustrates that here. So you can see where the arrow is here. In this situation, you've got an affected father and an unaffected mother. And the big D and the little d, the D's just represent the gene pair. And in this case, little d is a normal gene, so the mother doesn't have hereditary pancreatitis, and big D represents a spelling mistake. So this chap here, he's got a big D and a little d, and he has hereditary pancreatitis. And these cases down here just show the 4 situations when this couple could have a child. And each time they have a child, he would have a 50-50 chance of passing that gene fault on. So if a parent has hereditary pancreatitis, there's a 1 in 2 risk to all offspring of inheriting that same gene fault. Now in actual fact, the risk of being affected with hereditary pancreatitis is actually lower because only 80% of people that carry a gene actually go on to develop the condition. Around 20% carry the gene but seem to remain symptom-free throughout their life. Now, this is an example of what we do in genetics, the way we represent families. So this is what we call a pedigree, it's the way we draw up family trees. And this particular family tree here is for a family in America known as S family, and it was one of the first families that hereditary pancreatitis was studied in. So if you see circles are females, squares are males, and if they're coloured in white it means that they have hereditary pancreatitis. And if they're coloured in blue like this, it means they've been shown to carry the hereditary pancreatitis gene, but they haven't got any of the symptoms. A line between two people here represents a marriage, and then down here this shows the children of that marriage. So in this situation, you can see this chap up here had hereditary pancreatitis, and both his children inherited that gene from him, and you can see it tracking down through the generations, so that in every generation of this family there are cases of hereditary pancreatitis, and in some cases there are people that have carried the gene and passed it on to the children, although they haven't developed the problem themselves. And I'll mention more about the kind of family trees later, but this is basically a very important tool in genetics, because this is the way we gather information from families. And by representing families in this way, it's a very quick and easy way to look at it and assess what the family history is. So just moving on to talk about genetic testing for hereditary pancreatitis. It's actually done at the regional genetic services, so in our department down at the Institute of Genetics, or in regional genetic services across the country. Referrals come to us from consultants, either surgical or medical, from primary healthcare teams, so GPs and practice nurses. Some people self-refer, they've got some information that they're concerned about and they ring up and ask for an appointment. Other genetic centres might send patients across to us, and we might get referrals through from specialist nurses. Within the genetics department, the clinical team consists of consultant clinical geneticists and their juniors, the specialist registrars, genetic counsellors like myself, and the genetic counsellors come from a mixture of backgrounds. Some of us come from a background of nursing, and some of us come from a more scientific background, having done a science degree and then an MSc in genetic counselling. We all do the same thing, but we just bring a different mix to the work that we do. We also work closely with the cytogeneticists and molecular geneticists, and they're the lab workers within the institute. We've got a huge admin support, and there's also a lot of research that goes on. So within our unit, there's 110 NHS staff and over 250 people working in total down at the institute, and that encompasses university staff and research. And this just shows some of the things that we actually do within our department. The biggest thing we do is genetic counselling. And it's not counselling in the sense of kind of taking you back to your roots and regressing you back to your childhood and asking about all your problems in life. It's counselling purely around a genetic condition. So genetic counselling involves taking someone through all the aspects and implications of having a genetic condition within the family and giving them the resources to deal with that, having the appropriate screening arranged. A small proportion of our work obviously includes diagnosis. Some people come with a diagnosis, and then some people will make the diagnosis. We also do a lot of laboratory liaison and research, and also a fair amount of education. So who can we test for hereditary pancreatitis when people are referred through to our department? At the moment, we're in a situation where if there's a known family history of pancreatitis, we can take a blood sample from someone that's had recurrent attacks of pancreatitis and has a family history to see whether or not we can find one of these spelling mistakes in one of the genes that cause pancreatitis. And if we find that spelling mistake in an individual, we can then go on to test their first-degree relatives, so their siblings and their children. At the moment, we're not able to take a blood sample unless we know there's a definite gene fault in an affected individual. We can also take blood samples from people who've got a strong history of unexplained abdominal pain that resembles pancreatitis. And we see quite a few people in that situation where there's no explanation for their pancreatitis, they've got no history that would explain why they've had it, and sometimes they're referred to exclude hereditary pancreatitis as a cause of their problems. Who we can't test, at the moment we can't just take a blood sample from anybody in the street and say you do or don't have hereditary pancreatitis gene. We have to find the gene fault in someone that has pancreatitis before we can offer it to unaffected individuals. And that's because at the moment there's likely to be still quite a few genes that we don't know about that can cause pancreatitis. And until we can completely know all the genes that cause a condition, we can't be sure enough to test unaffected individuals at the moment. We also don't tend to test unaffected children in families with hereditary pancreatitis, and by children I mean people under the age of 16. And that's more of a consent issue. We prefer to see people when they're old enough to understand the implications of having a genetic test and give their consent for it. It's a slightly different situation. We do see a lot of children, do test a lot of children for hereditary pancreatitis, but they tend to be people that have been suffering with pancreatitis for years. It's more of a diagnostic issue. So if we see children that have had repeated bouts of pancreatitis and have a family history, then we do test them. But if they're symptom-free, then we tend to wait until they're old enough to give consent for a genetic test. So what happens once you're referred to a genetics appointment? Well, regardless of a condition within the family, it's the same kind of pattern that's followed for people being referred to genetics. And one of the first things that happens is we draw a family tree like the one I showed you earlier. Except the ones that we draw, we have names, dates of birth, and a lot more information written onto it. And in that situation, it means we've got one page with all the details about the family on, and we can see at a glance exactly what's going on. It makes it very easy to assess the situation within the family. We discuss with the people that have been referred information about the condition, give them information about how it would affect you, what the risks of it are in the general population, what the screening is for it, what the treatment is, etc. Give them as much information as possible about the condition. We then do a risk assessment based upon the family history. So if we see someone with a strong family history of pancreatitis, we can give them an idea of what their chances of having inherited that is. And if we're seeing people for a condition where we know we can do genetic testing, we can discuss the implications and the limitations of genetic testing and all the issues surrounding that. So if we get as far as the genetic testing, obviously having a genetic test is quite a big decision to take. We want to have a discussion with them to make sure they understand all the implications of that. It's slightly different if someone has hereditary pancreatitis and they have a test to see if they carry a gene. It's a diagnostic test, so you're just confirming why they have pancreatitis. In someone that is symptom-free but the conditions in the family, obviously there's a lot more implications to consider. So you've got someone that is currently well that's coming along possibly to have a genetic test where we could be telling them they've got a very high risk of developing pancreatitis. So they need to understand all the implications that go along with having a genetic test. And once they've understood what's involved, we need to take their written consent for us to take a blood sample and to test it. We then take a blood sample and we make arrangements for further appointments so that we can recontact them once we get the results. Now at the moment, in situations where it's a new family that we haven't got a previous gene fault found in, it can take 6 to 12 months to get a result back to find an actual gene fault, and there's no guarantee of a result. All our samples are currently sent down to a laboratory in Liverpool for testing. So it's not the sort of blood test that you'd normally have at hospital where you have it taken one day and within a few days, or certainly no more than a week, you usually have the blood sample, the results back. It can be quite a long wait. If we see someone that's relative has a gene fault, then it's a quicker turnaround because we know exactly what spelling mistake we're looking for. And in that situation, it's about a 4-week turnaround before we have results for people. Once we have the results, we arrange to see people again to let them know. And in cases where we've confirmed a diagnosis of hereditary pancreatitis, we liaise with them and make plans how we manage them in future, what follow-up they'll need, which consultant will need to be involved in that follow-up, and how often they need to be seen. Now obviously genetic testing, as I mentioned, there's quite a few kind of limitations and implications of it. And some of the benefits of having genetic testing is just, in many families, is clarity of obtaining actual diagnosis. There are many families where there have been recurrent cases of pancreatitis with no apparent cause, and it's a relief to, in the end, to have a genetic test that says this is a condition within the family, it's hereditary pancreatitis, and all of a sudden they've got a name, they can look up information on it, and I think it puts an end to some of their uncertainty. Genetic testing allows us to identify at-risk relatives, so in people that haven't got hereditary pancreatitis, it allows pre-symptomatic testing so that we can identify people that carry a gene fault but as yet don't have symptoms. And in that situation, we can offer them advice regarding lifestyle, any kind of information about screening, etc. that they would need. So it gives them a chance to have a positive approach to the condition within the family. Genetic testing can sometimes reduce the anxiety and uncertainty. It can provide relief for people that have a negative test, so they can be reassured that they're not going to develop the condition that's within the family. And also for people that have a positive test, the certainty of knowing allows clearer decision making regarding lifestyle, etc. Now, what's the limitations of genetic testing? Genetic testing does carry quite a number of psychological impacts. People can feel very anxious around the time of genetic testing. People can become very guilty about the possibility of passing on a genetic condition to their children. So particularly people that have suffered with pancreatitis, they've had a lot of problems with it, they've gone through some quite difficult times, and then they find out there's a chance that they could have passed this on to their children, and their children could be going through the same things that they've been going through. So people can feel very guilty about that. And there's also people that get quite depressed both about their own diagnosis and also about the diagnosis of the family. And part of our role is to try and help people deal with these feelings and find ways of coping. And the main way of doing that is just to give them as much information as possible. Genetic conditions are completely out of people's hands. They've got no control over what gene they pass on to their children, and they have no control over, whether or not the children did or didn't get the gene. So we need to just make them feel that this wasn't their fault and it's just one of those things, and give them as much information as they can to try and cope with that. I mentioned earlier that not all the genes are known yet, so in some cases you can be in a situation where the results are non-informative. So in families where we haven't yet found a gene, and we send the blood samples off and it comes back and they haven't found anything again, that doesn't mean that they haven't got a gene for hereditary pancreatitis, it just means they haven't got any more of the known genes. And what we say to those people is that, well, maybe in a few years we'll have to do further tests because there might be more genes we need to look at. And so it's a kind of watch and wait with those people because we've not been able to give them a conclusive answer. Genetic discrimination is another kind of drawback. At the moment there's no evidence of this happening, but I think it will come into being very soon. Insurance companies, mortgage companies are currently asking about family history of all sorts of medical conditions and are weighting policies just based on family history. At the moment they're not asking about whether people have had a genetic test, but I think it will come to that. And I think in that situation that policies will be altered because of that. The only thing to say about that is in some ways genetic testing might be able to help with that, because if your policy is weighted because of a family history of hereditary pancreatitis and you then have a negative genetic test result, you can then go to the insurance company and say, look, I've got this family history, I've got a test here, so I definitely don't carry the gene that causes it, so it's not an issue for me. So it can work both ways. And one of the main limitations of genetic testing is we're testing people for a condition and letting them know they've got a condition for which at present there's no prevention or cure, and people can find this quite frustrating. So finally, I was just going to fill you in on what happens outside of genetics. We feed a lot of our kind of families into a research project called EuroPac. And EuroPac is a big European study looking into hereditary pancreatitis and also familial pancreatic cancer. It stands for European Registry of Hereditary Pancreatitis and Familial Pancreatic Cancer, and it's based in Liverpool, at the University in Liverpool. And it's a big study investigating the causes behind hereditary pancreatitis. And people that are recruited into the study are sent questionnaires asking about both the medical history and the family history, and also blood samples are collected both for genetic testing and for storage for further research. At the moment, anybody that we see within the genetics department for a family history of hereditary pancreatitis, we give information to about this study. And people that are interested in joining us, they don't actually have to go to Liverpool. It's all done via kind of local genetic centres. So we can hand out the questionnaires, we can take the blood samples, we can forward things to Liverpool. And in fact, researchers do come up and down the country from Liverpool to kind of visit the families that they recruit. I've put a website address on the bottom there. It's quite a detailed site giving information about the study. I've put some handouts, I've given a handout for the talk to David, so if anyone wants that website address, he can maybe pass it on to people, maybe put it on my email list and people be able to access it. It's got information about that study and other studies, and it also has links to other pancreatitis sites. So any questions?
Are you doing any more testing of people with hereditary pancreatitis over the last few years? Is it sort of on the increase for testing, or is it generally quite limited?
It's difficult to say. There's been a change in how the genetic testing's done. I think initially consultant surgeons and gastroenterologists were used to take blood samples and send them off for testing to look for hereditary pancreatitis and feedback the results in their clinics. And so we didn't have a handle on how much of that went on. But since it's been kind of centralised through the genetic service, there's a steady flow. We're seeing a steady flow of families coming through the department with a family history of pancreatitis who were initiating testing for that. we're getting a fair number of positive results, but there's also quite a few families where, you know, there's no explanation for it, and they're just on a database for us to get back in touch as and when we've got more information. So it is increasing.
Yeah, it always seemed to me that pancreatitis itself was one of these illnesses where it was very bottom of the list to be tested for. If you've got something wrong with your stomach, we'll check for something else. And yet it seems to be quite a major one.
Yeah. I think if there's a family history of pancreatitis, that I think you very quickly refer to genetics to look into that. So there's several cases within one family, so it's a good case, you know, it's a strong case for them referring through to genetics to discuss it. One of the chaps from the study down in Liverpool, the Europac study, is coming up to this area to just update his database, and he was commenting that the North East actually have a higher incidence of hereditary pancreatitis than anywhere else in the country, but that's down to one common mutation that tracks back to a family that's been in this area for years, and so that family's kind of spread about and it stayed in this area.
It's a Viking family or something like that.
I think possibly it was,
yes.
yeah, that goes back to the Vikings, yeah.
One particular village or something silly like that. I
Yeah.
remember hearing about it. Maybe it was one of these meetings
Yeah.
years ago.
Yeah.
Months and months ago. But yeah, I remember it.
Yeah.
What was that Mario?
I can't remember the surname to it.
As far as children are concerned, if they did start showing symptoms, how would you go about getting them screened?
If they have symptoms of pancreatitis, I mean, it's just a matter of getting them into kind of down. If it's severe symptoms, just getting them investigated and under a kind of consultant within either a paediatric consultant or like Mr. Chalmers here. And from the point of view of genetics, we rely on children being referred in. So as we don't do any of the investigations ourselves for pancreatitis, we kind of see them once the symptoms have been dealt with and they're under control. We see the family to investigate whether or not this could be hereditary. So.
If the pancreatitis patient, the cause was unknown, is it possible that it could be hereditary?
It is, yeah. I think we had quite a few cases where, I mean, it's a bit of a long shot. There's not a strong family history, but if it is truly, you know, quite often we have very young people that have got terrible kind of history of pancreatitis attacks. It is worth doing a genetic test on the off chance that it is hereditary. Everything has to start somewhere, and so it is possible that even in the absence of family history, we could find a gene fault. And also, if you consider that it's possible for people not to show symptoms, sometimes it's just hidden itself. If you know, it's a small family and there's not many people within the family, then it's easier for the people that don't develop symptoms to kind of hide it tracking through the generations. So we do see a number of people where there isn't a history, but they've just got an unknown cause to their pancreatitis. Yeah.
Is there a link with diabetes as well? Patients show diabetes.
It would depend what the cause of diabetes was. Certainly when we're taking family histories, we look at related kind of conditions. So when we're taking the family history, as well as asking if anyone's had pancreatitis, we ask if anyone's had gallstones, if anyone has diabetes, etc. And sometimes, because the pancreatitis can lead to loss of function, can sometimes lead on to kind of diabetes, then that can be significant within the family history. It's certainly something we ask about, yeah.
Am I right in saying that at one point cystic fibrosis was brought into this scenario as well?
Yeah, that's right. It was thought that there was links between that, and a big study kind of looking at cystic fibrosis families and hereditary pancreatitis and testing for both. I think the figures that link the two were a lot lower than we thought, so we've stopped doing that now. I think it's kind of there was a proven link, but I think the incidence of it is much lower, and so we don't routinely kind of link the two tests now.
Yeah. The families at risk, especially with the ones with the young family, is there any sort of format that they can take for diet that is available for them
We just give
to prevent, say, the unbearable pain that you get quite often?
Yeah, I mean, in young people, I mean, it tends to be kind of young, kind of teenagers that we see. We give advice about kind of not smoking, healthy diets, you know, avoid alcohol, you know, avoid very spicy food, you know, the usual kind of healthy lifestyle advice. It's difficult, but I mean, there are dietitians that are very good at kind of talking to these families and kind of giving them advice. And I think they probably take it more happily from a dietitian than from a geneticist. So it's sometimes better to kind of put them in contact with someone that they'll really take notice of. We have leaflets about healthy lifestyle and things, but they're quite general ones. But it is difficult, particularly in the teenagers don't often want to know. You can see by the look on the face that you're telling them to avoid all these things and they're not going to blind don't notice until they have an acute attack, and then they might start.
Yeah.
It's quite difficult.
You say that there's no known treatment yet. Is it envisaged at all that stem cell research may eventually help?
Well, I think possibly, but it's a long, long way in the future. Yeah, and I would think that as far as the stem cell work goes, hereditary pancreatitis wouldn't be high on the list of what that was used for first. It is being looked at in lots of different things, and it may well come into all sorts of conditions.
Yeah.
But I think that'll be a long way into the future.
Because it would be not so much a matter of replacing tissue as doing something else.
Yeah, I think I mean, we don't mention it to people as a possibility yet.
Have any of the results ever shown stress plays a big part?
People report that, but it's difficult. It's really difficult to quantify stress in terms of what one person finds stressful is very different from what another person finds stressful. So it's really difficult to kind of quantify that, and there haven't been any studies that have shown how stress plays a part in that. We quite often get asked that question, but it is really difficult. It's a really difficult thing to measure, and it's certainly be a really difficult thing to link into to the condition. The other thing to say is that it has been shown that people who are stressed and your immunity can be low, and that might play a part. But it would be really difficult to categorically kind of link something like stress just because of the difficulty in measuring what that was for that person.
Any other questions? I can't resist one. It seems an awful long time, that 6 to 12 months to get a test result. Is it, I mean, when people are looking for other DNA related things, I mean, in criminal cases or whatever, it doesn't take that long. Is there a special reason why it takes such a long time?
Yeah, that's only in the families where there's not been a mutation found in the past. So you get a blood sample from someone who's got pancreatitis and has a family history of it, and you suspect that it might be due to one of these gene faults, but you don't know that. And so it's like having a huge textbook and saying there might be a spelling mistake in there, and you've got to read it from cover to cover to see if you can find a spelling mistake. And so it's a very, very long process. Now, once you've found a spelling mistake, the reason that for the 4-week wait is that you then know what page that spelling mistake on, what lines, and you can go straight to it and look for it. But it's just trawling through a long coding sequence, and you're looking at big genes that you've got to trawl through it all, looking for a mistake that might not actually even be there. So that's why it takes a long time.
And it's the Liverpool people that do it.
That's the reason. We used to do it up here, but they're kind of centralising different services, and Liverpool do it now. And I think what they tend to do is wait. The other thing that can delay things is they wait until they've got some of the machines that do it. They have to run a certain number of samples, so they need to wait until they've got enough samples to run in one go. So that can sometimes not start date on, but it's just a long process to look through to it.
Striking.
Would that also mean you don't know your full family tree? You would know, like, say, a parent has had pancreatitis, and you think, like, further up the line, but you don't know everything about further up the line, if you know what I mean. That's something that would cause more problems as well.
Once it comes to having a genetic test, if you've taken a blood sample from someone that's got symptoms, you're looking at their DNA and their blood sample, so it's specific to that person, so it's regardless of, you're just looking in their sample for a gene fault. That situation can kind of complicate things, and people have got limited information about their family. Obviously, we've got limited information that we can kind of base their risk on, if you like. But not having much information about your relatives wouldn't affect the actual blood sample you know, how long it took to look at that, and it would just muddy the waters with us in how we assess that person's risk, really.
How do we compare with the research to say the rest of the world or the rest of the civilised world?
How good the research is?
Yeah, into hereditary pancreatitis, yeah.
Yeah, I mean, if you look on the internet, Europac is a big study. America always has a lot more, and there seems to be a lot of it, but I'm not sure that necessarily means that they're better. America seems to have an awful lot of websites, and there are a lot of studies going on into it, but there's a lot of independent research there. I think it's quite good that Europac's a kind of concerted study across Europe, so there's lots of different countries feeding into it, and they're gathering a lot of information, so I think eventually the outcome will be kind of quite a good database of information, but I wouldn't like to say who's better than who.
There's no particular area to go to, like say in the middle of nowhere where this family started all and say, oh well, this is where we get most information from.
It was America that the first information came out from,
yes,
if you look from that the kind of S family or whatever it was. And I think because of that, once it started somewhere, then, you know, if you look at the information on the internet, there's literally hundreds of different sites that they have relating to that. But that doesn't necessarily mean the best, as I'm sure we'll be catching up with.
Right.
Is there much funding for it in this country? Do you struggle to get funding for research?
It's variable. The Europac's certainly a big funded study. All the work we do within the department is NHS kind of service provision, so the samples that we take are for diagnostic purposes rather than for research. But certainly the Europac studies a well-funded study. I think there can be, if you have like the smaller studies, you have to apply for kind of grants from pharmaceutical companies, etc., and that can be more difficult. So you've got to put a very good case across, and there's, you know, a lot of people competing for the same money. But with a big study like that, there's not a problem.
That American study showed about 5 or 6 generations. Have you actually gone back that far?
Any of our families?
Yes.
We usually try and take a family tree as far back as kind of grandparents and great-grandparents. It's unusual that people would know the family history that far back. We occasionally get people in that are as a hobby researching their family tree, and they can give you loads of information about what people had and what people died of. But you'd be surprised at how little people actually know about the family history when we come to see us. We can be quite limited. I mean, you get families where you can see 2 brothers and they give a different family history, even of their own siblings, let alone of once you get further back. So it's amazing, you know, people don't necessarily know an awful lot about the family history, so we very rarely get a family tree that's that big.
That's what I was thinking.
Yeah.
And what about medical records? Can you use them, or?
We can send for medical records to confirm reported diagnosis within the families. It would depend what relatives they were, because they're not kept once somebody's died, or, you know, if it's someone from years back and they're no longer around. Medical records aren't kept for that long, so they may have been destroyed. So it can be more difficult.
I told you it was going to be a fascinating evening, and the intricacy as well as frequency of these questions is testimony to that. Is there anybody else wanting to ask a question? Shall I, in that case, simply thank Lindsay very much for that fascinating presentation and for the lovely way you've just handled questions. That's particularly helpful, and I'm sure will enable people to take away a lot of information, a lot of points to think about that we've been able to raise and discuss with you. You mentioned the handout. I'm waving it now. It shows all the various slides that Lindsay has put on the screen for us, and I'm sure that you wouldn't mind, Lindsay, would you, if at some future point we photocopied those for anybody interested, and it particularly has that internet address at the end in your penultimate slide that you could take a note of tonight if you wanted. So, may I just say thank you very much, and we'll thank you in the normal way.